Welcome to CarePod, a safe place to educate, inspire, and renew the caregiver. Listen in with our host, Dr. Kipley Bell, as she interviews different experts along the caregiving journey.
So I'm here today with a thought leader. You know, I love thought leaders, game changers, people who have a heart for the older adult person and can craft our environment, our policies, the ways in which we serve the older adult person. So I am here with Dr. Charnise Moore, Chief Officer of Foundation of Senior Living. So thank you so much for joining me here with the Care Pod today. I appreciate it. We spoke a little bit about offline about your intention for the organization and essentially that we're here and now in terms of the graying of our country and what we hope to achieve in serving this population. So welcome. Thank you for joining me.
Thank you so much for having me, Dr. Bell. I'm so excited to speak with you and share with your audience a little bit more about FSL and just the amazing opportunity that we have in front of us in the state of Arizona and the country as a whole as it relates to seniors and caregivers.
Yes. So let me back up. First of all, I ask all my Care Pod guests their why. So kind of what brought you into this entree into the aging space? What keeps you here? What invigorates you, and so forth?
Yeah, that's a great question. And I think like most people, whether we recognize it or not, we have all touched caregiving at some point in our lives. If we haven't yet, we surely will in the near future, or we are going to be someone who needs a caregiver. So I'm no exception to that. Caregiving has touched my life already personally and my parents as well. My maternal grandmother lived with us when I was a child and came to live with us when she was perfectly normal and healthy, and then got hit with a cancer diagnosis and was aging rapidly as well. We had to step into a caregiver support role. And it was really a whole family hands on process of being a caregiver to my grandmother. Obviously, both my father and mother took on the brunt of that responsibility, but each of the children, myself and my two siblings, we also had responsibilities and things that we were, expected to help with in terms of that caregiving process for my grandmother. And, I'm in that position right now today with my parents who are aging. I've got aunts and uncles who are in that space right now, caring for their spouse and their loved ones. So, again, it's just something that will touch the majority of us. It's touched me. And I also have a background in public health. So I just have a passion for people in general. I love helping people. I love helping kind of think through and solve and address larger societal issues, whatever those may be. So I kind of came into this space and working with FSL because of that background and that personal experience with caregiving and coming from a household of caregiving, and then my background and passion with public health.
Amazing. And, there's something key that you said that struck me in terms of policy change and awareness.
Mm.
What is it about particularly the American culture and holding the elder in high regard as it compares or comparatively to global countries who position the elder in such a high esteem? What are we doing? What are we doing wrong? What are we getting right? How can we improve that?
Yeah, that's an awesome question. I think that we're in a very unique space right now in the US, right? We know that the baby boomer generation by 2030 will all be over the age of 65. We know that we're about to be in this space and time and in our culture and history where we're going to have more people over the age of 65 than under the age of 65. This is going to be a very unique space that we've never been in before. So when we start thinking about caregiving support, when we start thinking about healthcare services for seniors as they age, we've really got to think about that differently as a country, right? Because we will not have had this size population in our history before. So I think we've done a lot of things very well. I know that there are a lot of senior services that are available to people. I know that there are a lot of opportunities for respite care and service, but not necessarily enough, right? There's not enough to meet the demand that we're about to be in by 2030. When we think about other cultures and other countries, both in the US and outside of the US and in the larger world, it really differs by cultural background. You've got some communities that really respect and admire their seniors, and they really hold them up, and they never leave the home, right? They stay in the home, the family takes care of their loved one. They're ingrained with that social responsibility to take care of their seniors, even if it's not their direct parent. Seniors are held in high regard in some communities. In other communities, seniors are expected maybe, to have their savings in order, to have their retirement account, prepared and ready to take care of themselves. So we see different trends depending on the culture, depending on where you are in the globe, in the world. But undoubtedly, what we will see in these next couple of years and beyond going forward, what will be our new norm is we're going to have to do something collectively as a world, as a society, regardless of culture, regardless of upbringing. We're going to have to do something to protect and safeguard our seniors.
Collectively.
Yeah.
Collectively is the term. So what's the algorithm, right? For the common caregiver that, so many times even my own clients will say, I just don't know what to do. I don't know what's the step. What is the first step? I think, the beacon or the compass for our generation is, or probably because you and I are close to it, right? Like I already see the things that I need to do to put in place so that my
Mhm.
children don't necessarily have to, carry on certain tasks that, may be cumbersome in their age and stage. So, you know, get before we get into FSL and even the Arizona climate and space, I'm curious about even, what aging looks like in Arizona, right? But what's the algorithm, the steps that you say, okay, said caregiver, you're finding yourself as a sudden caregiver.
Mm.
What do you do next? What are your next steps?
Yeah. That is, again, a great question. And I know it's something that we're grappling with in Arizona. We've got a lot of task force and coalitions that are really gearing up to answer that very question. And I know that Arizona is not the only state looking at that. The algorithm, the next step for organizations and entities and policies and governments is really to break down silos. Caregiving, like we said, is something that's going to touch everybody if it hasn't already, but it can be so difficult when you talk to caregivers when they get that diagnosis for their parent or their loved one or their spouse. They're left thinking, what do I do now? Where do I go? Who do I call? Where's the support group? How do I manage this and the life that I've been living up until this point? Because just because you're now a caregiver, you still have to go to work. You still have to, take care of your family, your spouse, your children, the dog. You still have your community and social engagement responsibilities. You still have church. You still have all of those things. And caregiving is a huge responsibility. So I think the first step is for those people, entities, organizations, and governments that aren't the caregiver. Our first step is to break down the silos. We really need to come together. We need to create a pool of resources, access to resources, so that when someone has that new diagnosis and a caregiver finds themselves in this space, we can say, here's where you need to go. Here is your best first stop to help you navigate this process. Here are some support groups in your area. Here's the community that you need to get tied into. Here are the physicians and the clinics. And this is all of the support everything from a state level to the local level to the community level. We have to have tools and resources that are ready to go and be deployed to caregivers. And it's not enough to just have those resources. They need to be culturally appropriate, right? What works for one community is not going to work for the next community. Being a caregiver looks very different, again, based on the culture that you're brought up in. The word
Yeah,
dementia or Alzheimer's means
these
something
different
different.
things. Yeah.
Yes.
And not to even interrupt you there, but I do this whole teaching around the culture of caring. So it's
Mm,
not even the culture in which, as it pertains to heritage, right? But culture of your work environment, the culture of
mm,
your family. Like maybe your family is, warm and fuzzy, but your physician may not be. It's more scientific and stoic. How can your family, achieve outcomes that will best serve your older client if there is a mismatch between, what drives you, if you're emotionally driven and your care team isn't,
right.
how do you affect change that way? So,
Yeah.
so important. And, I don't know if it's me, but I'm frustrated with systems,
Mm,
that's we have systems, we have policy, we have so much to offer. But, if I'm trying to caregive my older adult person and I'm on hold with, CVS music for, 30 minutes to get through, or I want to do a mail order to get my person their pharmaceutical, these things are exasperating and stressful in a time when you're trying to best serve an ailing person.
absolutely. Absolutely. So and that ties in perfectly with the question that you just asked. I talked a little bit about what we can do as a society, as systems and organizations and entities. But you also said, what's the algorithm? What's the first step for the actual caregiver? And you're talking about what's the culture of your family? What is the best way to care for this loved one that you're now responsible for providing those caregiving services? It's important to have that dialogue. Ideally, before someone gets in a situation or gets that diagnosis that makes you become a caregiver, it's important to talk about and have the discussions. What do you want your healthcare to look like? What do you want us to be able to provide to you? What do you want your senior living arrangement or respite care services to look like? What are you interested in? What are you not interested in? If you don't have the opportunity to have that question, that dialogue and discussion up front, and a lot of people don't, so don't feel bad if you find yourself in that situation. Try to ask that question now. Try to ask it at the onset. Caregiving is, there's not one approach that works for everybody. It's going to look different based on your family unit. It's going to look different based on how much time and access to resources that you have. And it's going to take a little bit of, trial and error. You have to figure out what works best for you and the person that you're caring for. So I say the algorithm for the caregiver, number one, have patience. Be patient with yourself and with the person that you're providing care for. You know,
And the
Forgive.
clinician that's caring for you.
Absolutely, absolutely.
Yeah.
And recognize, no matter what the healthcare situation is, whether you're caring for someone or it's your own personal care, you know, our healthcare providers are amazing. They see, treat, and touch a lot of people each and every day. But we have to remember that we are our own best advocates. Caregivers, you are your advocate for that loved person. So when you go and you meet with these clinicians and you have these appointments, make sure that you're utilizing your time well. Go in with your questions, have your list of questions, ask if you can record the conversation. A lot of providers will allow that. Ask if you can bring another loved person in to hear that dialogue and discussion as well, because as the full-time caregiver, it's very easy to be overwhelmed. You're listening to what the doctor says, but you're also paying attention to your loved one and trying to make sure that they're okay. Ask if someone else can come in that room with you. But really, it's important to give yourself the grace. Give yourself the grace, but also give yourself time to step away as well. Caregiving is a full-time job. It never stops. And we talked about work. We talked about you still have to care for your family. You have all of these other priorities. It's going to be important, and I know that it's easier said than done, to take a little time for yourself, to remember the things that bring you joy as a person and not as a caregiver, because we are only as good as how we treat ourselves, right? If we don't take time to step away and breathe and take a break and, have fun and personal enjoyment in our lives, we're not going to be good to anybody else.
That's it. Fill your own cup.
Absolutely.
Your own cup.
Welcome to Impactful Caregiving, where we believe that compassionate care begins with education and empowerment. Impactful care is more than just a CME accredited online course instruction. It's a philosophy, a commitment to equipping clinicians at the bedside with the knowledge and skills to provide the best care for the older adult person. We believe that when clinicians are educated, they become empowered to not only care for the patients they serve, but also to partner with and empower their colleagues and patient families. Impactful caregiving recognizes that behind every patient is a grandparent, a spouse, a loved one, a person who means the world to their own family. Through our one-on-one consultations, Impactful Caregiving empowers the layman caregiver and their family to begin important conversations and plan for their aging chapter. Our commitment doesn't end there. We also serve corporate clients who seek customized medical training for their staff, as well as consultations for aging accommodation and staff education in various sectors of business, travel, and hospitality. Whether you're a clinician caregiver dedicated to improving patient outcomes or a corporate client striving to provide exceptional care experiences, we invite you to partner with us. Together, let's make an impact in the lives of older adults and their families. We can redefine what age looks like as impactful caregivers.
Absolutely.
Your own cup. So tell me about FSL. Tell me about all the wonderful things there. Tell me,
Yeah.
about, the Arizona climate. You have a lot of natives, I would assume, as well in that space, in the aging space. I know I have some colleagues that do a lot of work in the native population, so curious about how that interplay, affects your space and work. So yeah, tell me about it.
Yeah, well, FSL stands for the Foundation for Senior Living. We began in 1974. We just celebrated 50 years this year, so we're really excited about that. We had a big celebration a couple of weeks ago, and it was amazing. So we've celebrated 50 years, but we also look forward to continuing to be in the community for 50 years and beyond. FSL, even though our name is Foundation for Senior Living, and we are 100% focused on helping people age safely in place in the state of Arizona. We also provide services to people 18 up, right? So
Okay.
we have a whole host of programs and services, 20 plus programs and services all around treating people who have developmental and mental disabilities, treating seniors, providing respite services for the caregiver, and then just being a resource for the community and the state overall. Most recently, we implemented a program called RISE, which stands for Resources, Information, Support, and Education. And we really like to refer to RISE as the heartbeat of FSL. It is the one-stop shop for our clients who already receive our services, but also for the community who has questions, and maybe for that caregiver who's just found themselves in this space as a caregiver. And where do I go? And who do I call? And what services are out there? Can you help guide me through this process? FSL and RISE is here to help answer those questions, help navigate you to either our programs or services, or either even those programs and services that we don't offer that are available in the community. We will help make those connections for you so that you don't feel alone.
So
We
like
are
a liaison to the population.
absolutely kind of like that kind of coordination and navigation service to just help you navigate this space if you don't really know where to turn. We do friendly calls, so we know that we've got seniors sitting at home. Maybe their caregiver or loved one is at work or at school and they have a few hours at home alone. We do friendly calls because we know that seniors get lonely. We do check-ins. We provide home delivered meals. And through those home delivered meals, we're able to do safety checks, make sure that that person is okay in their home, make sure that they're safe, the home is clean. We offer adult day health services in Glendale and Tempe, Arizona, where we provide respite services for the caregiver. You can send your loved one into us. We're open Monday through Friday from about 7:30 to 5:30. We have games. We
Love
have staff. We have nursing staff and social workers. We provide food. And it's really just a fun and safe environment. We help provide baths. We provide so many things so that that caregiver can get a little bit of respite. We also offer services again to those that may have a behavioral health diagnosis. So we have assisted group living. We do adult foster care for both seniors with a mental health diagnosis and those without. We have senior centers throughout the state where, again, this is more for socialization and to prevent isolation. So maybe it's not for those people who need help with daily living activities that we would offer through our adult day health program, but our senior centers are more for those people who just want that socialization aspect. We have a lot of games. It establishes community. Again, we provide transportation. We pick people up and drop them back off so that the caregiver doesn't have to take on that added stress of, oh, I've got to be at work by 8 o'clock. The center doesn't open until 7:30. I won't have enough time. We pick them up and drop them off, provide the meals. Bingo is really big at our
Yeah.
senior centers. Our
Gotta
seniors
go
love
and play.
bingo. They love bingo. So
Uh,
it's really fun to see them in their element and see the services and the life that we offer. I would say, I could go on and on about our programs, but I think the thing that stands out to me from when I joined FSL, we are giving hope to seniors. We're giving hope to caregivers. A lot of times, by the time people find us, they're depleted, they're wiped out,
mhm.
and they're so grateful to find an organization that can help them. Not only that can help them, but an organization that cares. A lot of our clients and our staff, for that matter, have been with us for years. We've got some staff that have been working with us for 35 years. And so when you think about that and you see the way that they interact with our clients, there's love there. There's respect there. We're talking to people. We're asking them how they're doing and what they need. So it's amazing to be a part of. I could go on and on and on. We also offer affordable housing because one of the things that we know from seniors is, especially this baby boomer generation, they want to live independently. They want to stay in their homes. They don't want to go into a facility and have someone take care of them. They want to stay as independent as they can for as long as they can.
That's it. That's it. That's it. I'm going through that personally with my Aunt Jenny right now. She's 96. I did a respite kind of as a test to,
Yeah.
oh my gosh, she's going to see her core cohort. I mean, resort style living, all the amenities that you could dream of, the activities. She was not interested. She wanted to be home.
Yeah.
So there it is. So I was able to get my question answered. Okay. So home is it.
Yeah.
That's the answer. Tell me, I have, there is this subpopulation, if you will, of caregivers of children with disabilities, of even who become adults with disabilities, where those of us that are caregiving aging parents, et cetera, this might be a season in our lives and a guidepost or an instructional, if you will, of how what our preferences are going to be as we age. But for the caregiver, that this is a lifelong commitment. An autistic older, child, a, child with severe mental and physical disability. How do we, how is that different? Oftentimes I'm asked to speak to that population and, I often share that, it's not the same. Like the caring of the older adult person, should not be lumped in with these, American Disability Act policies, that there are unique needs of the caregiver of an older parent, and there are unique needs specifically for the caregiver of the child that's disabled. How do you speak to those parents or to those caregivers?
Yeah. FSL really focuses on those who have needs who are 18 plus, but caregivers, like you said, they're caring for people, who may have had a disability from birth as a child to their adult child to their spouse to their parents. And I think the things that are important for caregivers for parents are the same things that are important for caregivers of their children, right? So again, it's going to be important to take that time to find that rest, to link in with the resources that are available in your local, your state community. A lot of those things are going to be the same, but I know that there's an added weight for caregivers of their child, especially if it's a young child and not an adult child. I know that can take a toll on the family. So if there are other children in the home and they may feel like they're not getting as much love or attention as the child who has that critical need, and it can take a toll on relationships. So they are different. It's very important to be keyed into those things and find the community and the support that's going to help you speak to that and address that for sure.
Yes, 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 yes. So as we round the corner, tell us how do you support family? Do you support families, that want a remote consultation, in terms of the service offerings of FSL, et cetera?
Yeah, so anyone could get in touch with FSL. We can guide you through all of our programs and resources. Our number is 602-285-1800. And if you call, you're most likely going to get in touch with the heartbeat of FSL, which is RISE. Again, they'll be able to go through all of our programs and services with you. Our clients that are already a part of FSL, we're continuing to provide service through them, help them navigate changes with all tax, with their health plans, helping them identify, hey, maybe you're attending our adult day health centers today, but your care and the service that you need may change in 6 months. It may change in a year. It may change in 2 years. You may no longer have the ability to come to our adult day health centers. What can we do? What services can we provide to you in your home? Or can we provide to your caregiver? So we're able to do those things as well. Again, I think I spoke a little bit about our affordable housing complexes that provide that independent living specifically for seniors. We have those spaces as well that we're able to offer. And then again, transportation. So we talked a little bit about how seniors want to remain as independent as possible. Giving up the car keys for some seniors can be very difficult and challenging. They don't want to necessarily rely on a loved one or a spouse to take them to and from. We offer transportation services where we'll pick you up, we'll take you to your doctor's appointments, we'll take you to the grocery store. That way they're able to maintain a little bit of that independence and that respect and dignity with the things that they need. When it comes to staying in the home, we also have a home improvements department within FSL, and that is all about helping seniors in their homes, right? So we come in, assess the home. Do you need a new AC? That's very important in Arizona, as our summer temperatures can very easily get to 120 and stay there for a few days. Do you need a new AC? Are your windows and door frames secured with weather stripping to keep the cool air in and the hot air out? Is there anything that we can do for your roof? Can we install grab bars so that you feel safe getting into your bathtub, getting into your shower? Do you need a bench? Those are some of the things that we do to help people stay in their home if they want to.
Amazing. Amazing. What's the website?
www.fsl.
www.fsl.com. I love it.
Yes.
So give us some parting words for my CarePod audience.
Well, I want to tell all of the caregivers that are listening, I know that it is a journey. I know that it can feel isolating at times. and that it's challenging. My parting words for you: give yourself grace. Take time for yourself. I know it's easier said than done. About 70% of caregivers have been clinically diagnosed with depression. About 70% of caregivers have been clinically diagnosed with depression.
That is incredible.
Take time to take care of yourself. It's not just about the loved one. You've got to find that balance. You've got to take time for yourself. Refill your cup so that you can help your loved one. And if you're in the state of Arizona, and hopefully in the near future, even if you're not, FSL is here. We're your partner, we're your advocate, we're your resource. If there's anything that we can do to help, whether it's a service we offer or if we can connect you with another organization, we will do that. We want to make sure that we can support our caregivers and the rising population of seniors that we'll see in the next couple of years.
Amazing, Dr. Moore. It was such a pleasure to sit with you. Such a pleasure.
Thank you so much for having me.
Yeah, it's important to have thought leaders that have a passion and a heart, not just a job, if you will, but really have a heart for the service of our older adult person. So thank you so much.
Thank you.